Dr. David Perlmutter here. Welcome again to the Empowering Neurologist. You know, we are pretty much all alike genetically, but then again, we're not. We all have subtle differences in our genomes that express themselves in many ways. And, you know, during this time when we are very much concerned about our immune response, how well our immune systems are working, and how we might respond if we, in fact, are infected with coronavirus, we know now that there are some genetic variations in humans that have a role to play in our outcome should we become infected. We're going to explore that today. We're also going to explore ideas that relate to nutrition and even supplementation, again, in the context of how our bodies respond if we are infected with COVID-19. Our guest is Dr. Sharon Hausman-Cohan. She's a medical doctor. She is the Chief Medical Officer and co-founder of Intellex DNA, her research company that looks at genomes available to practitioners around the country, and also her clinic, which is called Resilient Health, that's located in Austin, Texas. During the past 5 years, she has used her strong scientific background. She's a Harvard-trained physician, and breadth of knowledge in the fields of medicine, as we're going to talk about genomics, and also into the exploration of the mechanisms whereby supplements work. This all went into the development of Intellex DNA. This is a clinical decision support tool that has been used and is being used by licensed healthcare providers. The Intellex DNA clinical decision support tool is a way of making genomics both actionable and in fact very understandable, and it's being, as I mentioned, used in decision making by integrative healthcare practitioners, functional medicine physicians across the country. She has published peer-reviewed papers on the topic of genomics and environmental medicine, and she has also taught extensively across the country at various conferences for both healthcare providers as well as for community members. So let's jump right into our interview. Well, hello, Dr. Hausman-Cohen. How are you doing?
Fine, thanks.
Well, there's a great answer. That's a good place to start. You know, we're going to be diving into this whole COVID-19 issue as it relates to our genetics, as it relates to nutritional supplementation and all the things that you're dealing with in your clinic. But, you know, as we get started, I'd like just to start off with you telling us, how's it going? I mean, from your perspective as a provider and interfacing with people, how's life for you right now?
Well, I think that all of us have learned how to do a lot more by telemedicine, but as a family physician, I am still seeing patients. And in our practice, most of our patients feel pretty safe. And that's partly why I was excited to be invited to have this conversation with you today, because I really do think that we know enough about the virus, not that we can get rid of it instantaneously, but that using what we have learned in integrative medicine and functional medicine, we really can do a better job preventing the virus with that knowledge. And also, if somebody does get the virus, I feel like our understanding of, again, the root cause medicine that we all do as functional and integrative providers allows us to give our patients guidance as to what to take, how to have the response be not as dramatic. And fortunately, we have had excellent results with anybody calling us with a fever, being able to help them get well very quickly, and have not had any of our patients hospitalized. So, and again, people have told us that they also feel safe because of the conversations we've been having with our patients.
Well, that is certainly, I think, a different experience than we would expect in a typical walk-in clinic where, you know, people are going to end up having their nasopharynx swab, the specimen sent to a laboratory, and either a patient gets admitted to a hospital or they're sent home and hope for the best. So it sounds like you're actually doing something here on the front end that you find is helpful. So where do we start that whole process? What do we do with people that seems to have a better outcome?
Well, I think that the beginning is to understand what we can do that helps the immune system work better, understanding why are certain demographics getting ill when other demographics are not getting ill as frequently. Of course, this has affected everyone, but certain ethnic populations, certain age demographics have obviously been hit more significantly. Understanding the genetic makeup that different people have that might make them more or less at risk, and then helping those who are more at risk to understand what they can do. And so that's kind of how in our office we have worked with everybody to kind of to work with understanding what do you do for prevention so that you can obviously still social distance but live your life, be able to go to the grocery store if you're not at super high risk, and what can you do to protect yourself in a preventive way. What can you do then again if you get sick? And so I think that just kind of understanding that for your listeners as well will hopefully help them feel empowered, which is, I know what you're all about, is helping individuals feel empowered with their own health.
So we kind of have a broad stroke understanding about the higher risk people, older people, overweight, chronic diseases like coronary artery disease and respiratory issues, and certainly diabetes. Anybody else you'd want to add to that mix?
Well, now we're a very unusual office in that, in addition to being primary care, we use a lot of genomics. I have been involved in the field of genomics for a long time. And so, on our patients, we know a bit more about them than typical. And so, the other group of people that are high risk are people that are more prone to that severe inflammation. And that is responsible is due to the response of a number of genes, but another population that we have worked with would be people who have two copies of one of the genes that has been most highly associated with ending up with a systemic response and the whole respiratory, acute respiratory distress syndrome. So, if you want, I can go through an example of a case of actually one of my colleagues, a healthcare worker, who looked at her genomics, because again, most of our patients have done extensive genomics um, through the platform that we use, and talk about what we did for her.
Well, let's do that in just a moment. But I want to just, as a point of clarification, I think most people understand genetics, but what you are talking about now is genomics. And I think that's a far more specific kind of a description, a place where we do our work. So maybe you could just tease those two ideas apart for us.
Thank you for that reminder. When you live in a world of doing something, sometimes you forget that not everybody has the same vocabulary. I'd be happy to do that. So we think of genetics as big events that happen with your DNA. So going back a step, inside every one of our cells, we have DNA. And DNA is the whole code for everything that goes on in your body. It codes for all the enzymes, the receptors, the nutrient transporters, the different genes that make inflammation. And that DNA is made up of building blocks that we call base pairs. And the building blocks are represented by letters. This may be taking people back to middle school or high school biology, but it's represented by these letters, C, A, T, and G. And you have about 3 billion of these letters in your DNA. And what genomics is versus genetics really has to do a lot with the magnitude of the event. So a genetic disease would be something like Huntington's disease, or when somebody has Down syndrome, trisomy 21, where they get a big genetic event happening, maybe like a whole piece of chromosome gets duplicated. The DNA is on our 23 pairs of chromosomes. That's where 23andMe got its name. And so you get a big chunk of DNA being duplicated, or a whole chromosome, and that tends to cause these illnesses or problems that we've recognized for many, many, many decades because they were such major genetic events. But now we have the ability to look at our DNA on a much more microscopic level, truly, truly microscopic, and look and see what happens if one little letter in the DNA changes. So you change a C to a T or a G to an A. And those little letters, when they change, we call it a single nucleotide polymorphism, a change in one letter. And those variants are not mutations. Everybody has them. Everyone has about 3 million of these variations in their DNA. And that's in fact what makes people unique. It's the difference between having brown eyes or blue eyes or darker skin or lighter skin. But these variations can also make a difference in how you respond to different nutrients, to inflammation, even to things like your cardiac response, to your bones, to your brain. And when you look at the variations, some of them don't make much of a difference. It's like changing one word in a recipe. If you change blend to stir, no big difference. But if you change bake to broil, it's a big difference. So that kind of a change where it's a one letter or little change in your DNA, that is the study of genomics, subtle changes in the DNA that are not disease causing by themselves, but can contribute to disease, can contribute to all kinds of chronic illnesses, and really make up a lot of chronic illnesses, things like cognitive decline, osteoporosis, heart disease, even obesity, when combined with your environment. So alone, there's no one change that causes heart disease, but there's 4 or 5 or 6 or actually hundreds of little changes, some more important than others, that can contribute to it. Well, the same thing is true with our viral response. There's not any one gene that determines who's going to get severe COVID and who's not, but there are quite a few genes that have already been identified that contribute to how easily you get coronavirus, and do you get that huge inflammatory response at the end that contributes to people ending up in the hospital or on a ventilator.
So several weeks ago, you and I were on the phone, video conference, and we were going through my genomic profile. And we were talking exactly about what we're talking about right now, is what do I have in store for me in terms of an inflammatory potential response if I were to get this infection. CCL2, I think we looked at, certainly IL-6 response. And we had a discussion about where I stood on the scale. But in a way, this is a bit of what we call predictive genomics, in that we could, by looking at this information on a given person, to some degree, I believe what you're saying is we might be able to predict who's going to have a more robust inflammatory response versus a less aggressive inflammatory response, and even who might be at higher risk for other manifestations of this virus.
Yes, and I think we have to be a little bit careful with genomics in that I don't like for people to feel like their DNA is their destiny, because it's absolutely not. Because if you know that you're at higher risk for inflammation, then you can be more aggressive with things that block those particular pathways. And so it does give us some prediction in terms of, in the population, it says people who have this particular gene SNP have 2 times the risk or 1.6 times the risk of having, severe acute respiratory distress, or have half the risk of getting severe viral infections. But then, and the same thing is true if we're looking at brain or atrial fibrillation or lots and lots of different things. You can look at a gene and say, in the population, this gene can increase a risk of something. But if we know about it and then we say, oh, but in this case, if we increase someone's potassium, or if we increase the underlying, address the underlying factor. So in the case of inflammation, if we are more aggressive about giving them things that block the inflammasome pathway, which we'll talk about because that may be a word that some people haven't heard of, then I think that it doesn't have to be their destiny. And so it's more about understanding people on a really different level. It's really the true idea of personalized medicine. I know you had Dr. Bland on last week or recently, and it's really that field that you and Dr. Bland have brought forward of saying we can do better. We can look at population medicine, but let's try to look at the root cause for individuals and help them be their healthiest selves, because not everyone needs the same thing.
I think it brings up an interesting point, and that is, as well, the other side of this coin is that if an individual were to test really negative or on the good side of these inflammation response elements, et cetera, not have genetic predisposition for activating the inflammasome, as you call it, as it's been called, but yet that doesn't give them free license to gain a lot of weight, become type 2 diabetic, have a little coronary artery disease thrown in, because that does tend to associate with senescence of cells, dysfunctioning of the immune system at a more macro level. So I think but on the other hand, great information for people to have to determine their risk. I had an interesting experience that I was presenting on a podcast, risk factors for bad outcome with COVID-19 infection, including coronary artery disease, type 2 diabetes, and obesity. And comments started to appear. This is a live broadcast that I was fat shaming. Well, I wasn't fat shaming. I wasn't diabetes shaming. I wasn't coronary artery disease shaming. I was just trying to get out information that would talk about risk, and that's good, empowering information. If you're in one of these categories or more of them, you want to be extra careful and do your very best not to contract this infection because it bodes for a worse outcome. That's the whole mission here. So we always have to walk this delicate line about information. And I think as it relates to genomics as well, I mean, it's not as if the die is cast if you happen to have a specific predisposition for inflammation, obesity, or whatever it may be. I think you just made a point that our lifestyle issues directly through their effects on our physiology, but also somewhat indirectly through how our lifestyle choices can modulate gene expression epigenetically. Really, the information is much more empowering when looked at through that lens.
Absolutely. And I think that that is a very good point. You obviously, when we use genomics, we don't want to just look at someone's viral response. We're trying to optimize the whole person. And we take that person who's struggling with their weight, who's struggling with their blood sugar, and we can get down to the reasons that they're struggling. You can be thin and have an insulin level of 2, which is a really good insulin level, and still have a high blood sugar and a high measure of what's called hemoglobin A1C, which is your blood sugar over 3 months, because you have genes that make it so that you don't make the signal that your stomach would release normally called incretin that lets your pancreas know that you need to release insulin. That's why your insulin level is low and you still have high blood sugar. Well, once you know that about someone, then you can tell them, look, we can either give you medicines that increase the incretin release or artificially give you incretin, or we can teach you to eat foods that don't require as much insulin. And so we give people choices. And so we also let our patients know when we're working with them on obesity or blood sugar or any of those things, of course, it's not about shaming. In fact, a lot of times people find it very satisfying to go, oh my gosh, this makes sense as to why I've struggled with my weight because my brain doesn't recognize when I am full, or I have a gene that only gets turned on with exercise that's really meant to be one of the regulators of metabolism. So absolutely, I agree. It's the whole person and just helping them to know themselves better.
So I think you wanted to present some information about one of your colleagues.
Yeah, I thought it would be a good way for us to discuss what the different listeners can do to help prevent COVID-19 and also treat it if they do get symptoms, in addition to whatever their doctor recommends, of course, but just giving them information. Because when we first started looking at the genomics of COVID-19, one of my colleagues who had done her DNA with me, she called me up and she's a 52-year-old or 50, I'm sorry, 54-year-old internist, and she's working in an urgent care primary care setting. So she's at high risk for exposure. And she's like, Sharon, should I stop work? I just looked at my genomics and everything on that inflammatory panel is lighting up. I have lots of SNPs for 2 copies of the ones for interleukin 1 alpha and interleukin 1 beta, and that CCL2 that talks about increased risk for the SARS with coronaviruses in the past. And what should I do? And I thought that that was an interesting case to kind of let you know how I walked her through this.
And that would be what our viewers are looking at in the first slide. In the next slide, you're talking about Sambucus. What is that, and how does that relate to viral replication?
Well, the first thing, just to go back one step, that I talked to Dr. Allison, as we'll call her, obviously I've changed her name, was to talk to her about that just because you see a lot of red in inflammation is not always bad. That the interleukin 1 beta gene, for example, that creates more interleukin 1 beta, in studies of viruses, and on this one, there's not yet one done with COVID-19 and this particular gene, but when they studied H1N1 and other viral infections, it actually decreased people's risk of getting the fulminant disease more than 50%, because being able to mount a good initial immune response is important, is how we fight viruses. So first I let her know, yes, you do have some risk if you get it of having more lung symptoms, but don't panic yet, because you being able to make a lot of IL-1 beta is actually a good thing. And that does tie into Sambucus, because Sambucus, which comes from elderberry extract, has been a little bit in the news because people have been debating, do we use it for prevention of coronavirus or not? And the reason there's this debate is the benefit of Sambucus is it's a very well-known antiviral. It was studied, it was a woman in Israel's PhD thesis many, many years ago, and it was studied in influenza and shown to decrease the days of fever with flu by about 4 days, and that's a big deal. On a mechanism level, it was shown that it knocks spikes, hemagglutinin spikes in the case of flu, which are a little different than the coronavirus spikes. It knocks off spikes off of viruses and decreases infectivity and decreases the viral replication as well. But one thing that has been very interesting is there was a study that was done in 2014 where they looked at a coronavirus. Now, this was a strain of virus that does cause the inflammation in the lungs, but it was a strain that affects chickens. It's really easy to do a study with chickens, a little harder to do ones with humans, although I strongly think we should be looking at them. And what they found is that Sambucus did work against coronaviruses. And Sambucus, or elderberry extract, has been found to work against a lot of different viruses. And so even like herpes and, again, flu and many, many viruses. So, but what they found is the way it worked is it was working early on in replication. So it worked better from a prevention strategy the earlier you took it. So in the graph that you're looking at, you'll see that where there's the red arrow, that's when Sambucus was given 20 minutes before exposure to a coronavirus in this study population, which again was animals. And in the purple arrow, it was 24 hours before. So you could see the best strategy was to take the Sambucus the day before you actually got exposed. And the second best strategy was still even taking it 20 minutes before. Now, taking it after still did help. But what I told Dr. Allison is, you, because you're seeing patients and she was working about half time, really need to take Sambucus before going into the office every day that you're seeing patients. So that was one prevention strategy that we were able to use with her.
Now, as we look at this scale, we are looking at the measurement of virus titers, the amount of virus in the body, in the experimental animal.
Right. And it's looking, the two different lines, the dark gray and the light gray, have to do with looking in the actual cells that were harvested versus in the supernate in the blood, essentially. So it's just two different measures of viral replication. I know it's a little bit tight on the graph. But
right, but again, what it's showing is that 24 hours prior to exposure, measuring then in both the blood and in the cell culture, is there's a pretty dramatic reduction in the amount of virus.
Right. Compared to that control, you can see that it is, a third to a tenth, depending on whether you're looking at in the cells or in the blood. And that's huge. And I've been recommending Sambucus. In fact, we sent out an email and did a webinar for our patients and had made sure all of our patients had Sambucus at home, because we've been having patients use it when they get a fever and they call me on call. The first thing I tell them to do is start on Sambucus, because if it goes away with Sambucus, it's viral. And then I can still see you if you want, but the main goal is we don't want to be using antibiotics for things that are viral. So making sure that we address viral causes of infections first is really beneficial. And it does work really well. I've had a lot of people go from 102 fevers to afebrile, no fever, in 24 hours with Sambucus.
So is this something that you're recommending these days that everybody take all the time, or just if they think they're going to be at risk for exposure?
That's a great question. I tell my patients, because most of my patients are sheltering in place, I do have a fair number of people that are over 60. And I say, if you're going to the grocery store, If you're going out, um, because you're going to a doctor's appointment or to do something where you're going to be with others and have any level of exposure, those are the days to take it. So unless someone's a healthcare worker, I don't have them taking it every day. It is probably safe, but number one, coronavirus is likely to be around for a while, and you'd go through a lot of Sambucus. And number two, the other side of the Sambucus coin is that it does increase IL-1 beta. It does increase inflammation. So that same gene that Dr. Allison had that made her have higher IL-1 beta that is associated with people not getting as many serious viral infections, upping inflammation day after day after day might not feel so great and may have other consequences. So I mostly use it for treatment, or for prevention. And in this case, we're talking about for prevention because I think there are some better options for treatment.
So
But
if in fact you are able to dramatically, I mean, I don't know if you can replicate this in people, but if you were able to reduce the viral load as aggressively as this study indicates, that'd be a game changer.
absolutely. And this is just the beginning of it. So there were a few other things that have great studies that I told Dr. Allison and my patients about. One, we know that proper levels of zinc can be beneficial. And I'm a big nerd. I mean, I started out doing a PhD in medicine and I like to know how things work. So anytime I read that something can help with whatever evidence, for in this case, coronavirus, I go back and I figure out why is it helping? Well, it turns out that one of our initial attack responses against coronavirus is something called our complement pathway. And think of complement as the first responders, kind of like the bouncers at a bar. They go in and they just kind of take out the bad guys. So, complement is this kind of big part of our immune system that pokes holes in bacteria and in viruses so that your body can fight them more easily and clear them more easily. And zinc is a very important part and very important cofactor for complement. So I also told Dr. Allison, let's make sure that you have enough zinc on board. And most of us don't know our zinc levels. And unless you're eating a lot of oysters, there's a good chance you don't have particularly high zinc levels. So I just had her take some extra zinc. Now, I wouldn't do that indefinitely, but without testing levels, but for a short time, that's really reasonable. And then we also talked about quercetin. Quercetin comes from apples and red onions, and it helps the zinc get into the RNA, into the virus. I'm sorry, it helps it get into the cells where it can help particularly fight the replication of single-stranded viruses like coronavirus. So we also talked
The
about
other
that.
thing interesting about quercetin is it is a what we call senolytic to a
Mhm.
significant degree. And what I mean by that is it helps us identify and rid our bodies of senescent or poorly functioning, aged, if you will, immune cells. So, along with something called fisetin, quercetin, are both involved in this process of senolytics. So, when you did my genome analysis, you indicated that I had some variations in zinc utilization, whereby I might not need to be taking as much zinc as I had been. So for my listeners, you may note that I did mention that I had backed off on my zinc a little bit, and this is exactly why. So what did you find in me? May as well tell everybody, and so it's interesting information.
It's a good thing you really have pretty good genomics. But that is there is really a lot of very interesting carriers for all these different nutrients. And it's not very common, but in about 10% of the population, people can overcarry zinc into the inside of cells, into the nucleus. And those 10% of the population are the ones who don't want to overdo it on zinc because it was shown in a study of cognition that in that particular group of individuals, making your zinc levels go too high, much above 70, actually decreased your cognition. Whereas in the rest of the population, the other, you know, 80, 90%, having it a zinc level in the 80s and the 90s, even at 100, you tended to have an increase in cognition. So that's why I tell my patients, if we haven't checked your zinc levels, if we haven't looked at your genomics, you're only going to do zinc, kind of boost it for about a month right now, and then we can talk about that on a one-to-one level when we meet and look at your genomics and look at your particular zinc levels.
You also have been really involved in Andrographis, and I think that's part of your program, perhaps now more than ever. Let's talk about Andrographis.
Well, I had not actually heard about Andrographis till a year or two ago, when there was a product that came out that was touted as a very good antiviral that was a combination of Sambucus and Andrographis and astragalus and some vitamin D, which vitamin D can boost the immune system. So I started researching Andrographis and found that it was a really interesting compound that has research going back in China, many, 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 I'm sure hundreds and hundreds of years. But Andrographis is another really potent antiviral. But in the case of coronavirus, it is very, very interesting because there are two ways that coronavirus enters the cells. And one way everyone's heard about is through those ACE receptors. But this particular strain of COVID-19 also uses what I'm going to call the back door. It uses this furin pathway. And if you inhibit that furin pathway, which is where some of the drugs that are being studied right now, the protease inhibitors, that if you inhibit the furin pathway, then the coronavirus does not do well. And it can't not only get into the cells, but it also affects its ability to get into tissue like the lungs and the liver. Well, it turns out that Andrographis is the only natural supplement that has so far been identified as a furin inhibitor. And it has, again, other antiviral activities as well that have been demonstrated in a wide variety of virus types. And then the third benefit of it is it decreases CCL2. So for Dr. Allison, I made sure, and again, I actually have most of my patients having a combination of Andrographis, Sambucus, different things at home, and tell people at the first sign of getting a fever, we're going to switch you from plain Sambucus to this combination product that has Andrographis in it, some astragalus, which also decreases inflammation, and the Sambucus. And what we have found is, again, really great responses when people call with fever to having their symptoms go away, both in terms of respiratory symptoms. Now, not all these people are documented coronavirus because we're just now getting the ability to go back and test and see who was, who wasn't. But the ability to have someone call me during coronavirus time and say, I'm feeling kind of short of breath, I'm having a little bit of a fever, what should I do? The first thing I have them do is start on this combination, which again, most of my patients have. And we've had excellent, excellent success with people telling me that they feel so much better in 24, 48 hours. The longest it took for someone to feel better was, I did have a senior where it took him about a week to feel better, but most people within a few days.
But to be clear, we would want any of our viewers who are feeling short of breath with a fever, the first thing that you need to do is contact your healthcare provider right away. You don't want to be medicating yourself, think that you're going to, pop some Andrographis and stay at home and everything's going to be great. If you're short of breath, heart rate's up, have a fever, you definitely at that point want to call your healthcare provider no matter what time of day it is. Because one thing we know, I'm sure you'll agree, is that some individuals go down very, very quickly in a matter of hours and think they're going to go to sleep and everything's going to be fine the next day, or at least the same. And often times, not oftentimes, but what can happen is they can precipitously decline. And then it's a real panic situation. Uh,
Yes,
you've
absolutely. Absolutely.
mentioned, perhaps I think surprisingly to our listeners, viewers, the idea that melatonin might be playing a role here, something we should be thinking about. I mean, most of our viewers know about melatonin from its helping us get to sleep at night functionality, but do you have some ideas in terms of how it might apply to the current situation?
Yes, well, people do think of melatonin as that just for sleep, but melatonin has some really important anti-inflammatory and immune modulating effects. First of all, it helps your good anti-inflammatory pathways, something called IL-10. Um, but it also seems to work particularly to help prevent inflammation in the lungs. And there have been a number of studies showing both melatonin and melatonin-like compounds to decrease the risk of acute respiratory distress syndrome and acute lung injury. And in fact, there's an article that technically hasn't come out yet because it's scheduled to come out in June of 2020, but it's available online, called COVID-19, Melatonin as a Potential Anti-Adjuvant, which means add-on treatment. And so melatonin is super safe because the doses that you need to bring your melatonin levels into the anti inflammatory range are very, very low. So when somebody is a baby, they have very high melatonin levels. That's why they sleep so well. And and that's also why we think that one of the reasons why the young people, the young children and infants are not as susceptible to coronavirus is because of some of the benefits of melatonin. But in order to bring somebody's melatonin level back to that level where has immune protective effects, it doesn't take 5 or 10 milligrams of melatonin. It only takes about a half a milligram or a third a milligram of melatonin. So there's very few people. There's some people who, if they take higher doses of melatonin, they feel funky or have weird dreams. But most people can tolerate a half or a third of a melatonin. And since we know that the melatonin curve is exactly or approximately opposite of the coronavirus risk of infection curve, where the seniors, as you get older, you have a much higher risk of ending up in the hospital with coronavirus. It makes sense to invest a few dollars in 1 milligram melatonins and take a half of one before bed, from my opinion.
So might we then say that things that we do to inhibit melatonin, i.e., blue light exposure at nighttime on the computer, on the TV, et cetera, inhibiting melatonin, might bode poorly for the immune system?
Yes, absolutely. We do think that we're doing a lot of things with blue light exposure. And in fact, I have my computer blue light glasses. I won't leave them on because they glare, but it's a really good idea to make sure you get some sunlight in the morning, especially even with coronavirus. You can go out for a walk, and getting exercise lowers your stress levels. It's good for your immune system. Having sun on your eyes without sunglasses before 10 a.m. actually helps you make more of your own melatonin. And then if you are working on a computer, and so many of us are working from home on our computers, wearing blue light filtering glasses makes a lot of sense.
Well, we have them, both my wife and I, at the bedside. We're talking about various supplements, these ideas maybe some of our viewers haven't heard of before, but let's get back, if we can, to food. And that is in the context of immunity, in the context of inflammation. Where do you stand? What should we be doing from a nutrition perspective?
Well, I absolutely feel that in general, whether you're talking about protecting yourself from coronavirus or protecting yourself from osteoporosis or heart disease, we know that inflammation is a big part of all chronic illness. And so, in general, really all Americans, and this is kind of a low bar, I think, but all Americans and all individuals need to be getting about 50% of what they eat from lots of different plants, from vegetables, fruits, brightly colored things, especially the vegetables. But even spices have a lot of anti inflammatory benefits. So I think that if you think about food not as just satisfying your hunger, but as giving your body what you need, we were meant to eat a lot of the things that nature provides. If you're talking in particular about ones that have particular natural antiviral benefits, there are some foods that kind of stand out. Garlic, ginger, oregano, those are all good spices that have known antiviral benefits. Basil and sage and oregano and curcumin and fennel as well. But just in terms of things that decrease inflammation and boost your immune system, obviously all the cruciferous vegetables, the leafy greens that are like kale and spinach and things like Brussels sprouts and cabbage and cauliflower. Um, those leafy greens also increase something called nitric oxide, which lets you deliver more blood flow, which is, of course, great for your lungs. And then blueberries have a lot of benefits, not just anti inflammatory, but also some anti aging benefits on things called sirtuins, which is also resveratrol in red grapes. And things like extra virgin olive oil have known anti inflammatory benefits. So, eating healthy is really important. And this is a great time to try out cooking. Look online for recipes that are simple. Order those bagged salads to start with from your grocery store and then add to them and experiment with new foods that can help your body feel well.
Well, I want to ask you something I've asked many of our guests, and that is, it seems a little bit unusual to ask a question like this, but uh, what is the what is the upside for you right now? What are you appreciating in your life? Is what's different that is on the plus side for you right now?
Well, I think that the plus side, and as a doctor, lots of different experiences affect me and change me. And the plus side has been every time I have a telephone or a virtual meeting with my patients, and even my 80-year-old patients have managed to figure out Zoom and GoToMeeting, which has been great. I always ask them, are they feeling safe? Are they worried? And it's been nice to be able to take the extra few minutes because we're not as busy. Most physicians aren't quite as busy right now. But to take those extra few minutes to get even in closer human contact with my patients, to talk to them and help them feel safe and protected, to let them know, of course, they're worried, but that we're doing things to protect them and going through the different things. And I've really enjoyed that going back to human contact. I mean, I always have had human contact, but being able to help someone feel safe. And we had talked, we went before, you had said, and I so appreciated it. Obviously, if you're feeling short of breath, call your doctor. But for patients that were overly worried, we've had them order in pulse oximeters, a $40 solution, so that when they're talking to me, and sometimes people get anxious and they can feel a little short of breath, they can actually measure their oxygen level. So we'll come up with solutions that are individualized for prevention, individualized for what to do if they get symptoms based on how much exposure they have, how much genetic risk, their age, but also just sometimes things to make them feel safer at home, and to know that I'm there for them. And so I've enjoyed a little bit lighter schedule for time for research, because I love research, but also to have time on the phone and in Zoom meetings with my patients to really help them feel supported.
Well, you said three things that I think are really important, and I'd like to amplify them. First of all, that in a very strange way, even though it's virtual, you're actually feeling like you're connecting better with your patients. And I'm hearing that actually quite a bit, that people are connecting in a little bit more, oddly enough, genuine way than they would have in an office setting where there's a keyboard between people, which tends to distance people, both emotionally and physically. The next thing is the fear factor. That's a really interesting thing to explore, because there's quite a bit of that. There's quite a bit of uncertainty about the future, insecurity, which is new for a lot of people. I mean, life was perfect before for a lot of people. Pretty well knew what to expect. Things came up, etc. But now, across the entire age spectrum, people are having to deal with the unknown. We know that it's certainly challenging for children to not know if they're going to be in the fifth grade, if they were in the fourth grade last year, what's going to happen. And for elderly, everybody is challenged by that. And the third thing, it's a bit disparate, but was the pulse oximeter comment. And I think that's actually a really good recommendation, because they're not expensive, $40. You can buy them online. Amazon has them, other people have them. And it is a really good bit of information to have on hand for when you're not feeling well, to be able to communicate that bit of information to your healthcare provider, because it's probably the most important thing that he or she's going to want to know. Sure, we want to know your temperature, but the oxygenation of your blood is a powerful predictor of where you're going to be 12 hours from now. So that is something I'm glad you brought it up, that I would absolutely encourage people to think about having it at home. Try it out before you're sick, so you're not struggling when you're not firing on all cylinders. But that's a great bit of information to have. So I'm glad you brought that up.
It,
What are you thinking? And I'm going to put you on the spot here. What are the next several months going to look like?
well, what I foresee the foreseeable future and what I hope may be slightly different. If I could, if I could have what I hope that as all of the different physicians with different backgrounds in the country and different scientists are learning more about coronavirus, that we will start doing more studies. I mean, this is the perfect time. So I would love to, as a scientist, again, I started out as an academician. I would love to see us using the hospitals or the outpatient clinics as a way of saying, okay, we know that andrographis has this effect in this cell lines, or works on furin, or works on antivirals, but let's pass out andrographis and these antivirals for a few dollars to somebody and see if they get better and study it, because then we have the publishable data and we know, is this something we as physicians should be recommending and have more information. So I would love to see us using this as an opportunity to consult with doctors across the country, across the world, and say, what's working? Let's get studies going and in a coordinated effort. Because I think coronavirus is going to be around for a while. It's going to be around a year, year and a half till we have a vaccine. And the strategy of, well, we'll wait till somebody gets it and then we'll let them go back to work, that is going to have profound effects on the economy. And if we could show that, particularly, for example, people in their 20s, 30s, 40s, the kids, that if they start to get it and they take some of these natural antivirals, they do extremely well, then maybe we could at least do stage of having people go back and have our younger people that are in relatively safe situations, not necessarily the ones with chronic lung disease, get back to work. That will give herd immunity. And other countries are doing this. So herd immunity is where you let some people get it. And if 80% of a population have been exposed to coronavirus, have it mild, it'll help to protect the more vulnerable. So that's what I would like, is for us to think as a country about how do we study different preventive strategies, get them out there to then the general public and to physicians, because most physicians don't get the opportunity to study supplements and nutrition. And it's a very academic field. It's just not one taught in medical schools. And then let's use that to get our country in a staged and safe way back to work for people where it would be safe, get the herd immunity up, and then it'll be safer for our seniors. I still am not recommending, I would not recommend that my parents, who are, my mother and father, go out and start, having parties and going and doing everything, because if you have somebody who has more risk factors, that's a different situation.
Well, what's coming to my mind right now is, thinking back about the Sambucus and, your approach. Uh, all the excitement right now, as you and I are having this conversation about remdesivir, with the data indicating possibly that it shortens, it reduces the timeline by about 31%. And some would say, well, gee whiz, 31%, that's not a big deal. Well, it happens to be a big deal if people are discharged from the hospital 31% earlier, because that it wasn't studied this time around, but it will be. The earlier you're discharged from the hospital, the more likely you are to live, obviously.
Right.
So it's going to have, if indeed it's just 31%, still that will be a major effect on our resources, on mortality, and certainly morbidity as well. And indeed, if some of the things we've talked about today could have a similar effect, I mean, I'm not saying these are head-to-head comparisons, by all means they're not, but I think it opens the door for us at least to embrace the possibility that some things that are not under patent and therefore being showcased because they are patentable approaches, that these are generic ideas, might well have huge utility. It's, as getting back to your recent comment just now, and that needs to be explored and studied by people at the front lines who can help to showcase why these things are important.
The other thing I love to see people studying, we know that the people who, let's getting back to the case, the woman, the doctor who has that high level of CCL2, and what CCL2 is, it's basically it's called a chemokine or chemotactant, and it basically calls in inflammation. Well, if you're over and more aggressive at calling in inflammation to your lungs, then you get this huge inflammatory response, and that's where we get the cytokine storm. Well, ultimately, the end product is the release or activation of something called an inflammasome, which is basically what it sounds like, a big amount of inflammation. And inflammation, if you get a cut and it gets red and you get irritation, you can have tissue destruction if you have too much inflammation. Well, there was some work, and actually Dr. Charles Sirhan at Harvard was nominated for a Nobel Prize for this work, showing that you can take something that they've called resolvins, specialized pro-resolving mediators, and those are available from a couple of companies over the counter, and it stops that tremendous inflammasome activation. So that's the other thing I think we need to be studying, is when we have somebody presenting to their doctor or presenting already with coronavirus type symptoms that are inflammatory, any of those lung symptoms, starting them on things that lower that inflammasome response. So there's so much we can do and study. And again, people think, because I have this very classic training also from Harvard, but then I'm an integrative and functional medicine, people are like, Sharon, isn't that kind of the opposite? And I say, no, it's actually the epitome, because functional medicine and integrative medicine, we're looking at root cause. It is the most scientific kind of medicine that I believe that we as physicians can do. And so I feel like this is an opportunity for the world to understand that, we're not saying, not that acupuncture and relaxation aren't important, but what we do is not just tell our patients to relax. We tell them to use everything that's in the literature of science, diet, lifestyle, that can help our bodies be better. And so I'm hoping that, if we have the lemons, which the lemons is this coronavirus that's destroying the safety of America and making people feel so stressed, affecting the economy, that we can make that lemonade and say, let's look at all the different kinds of science and medicine out there and see if we can't learn from each other across the world.
Well, amen to that. You're right. I mean, that's the idea of integrating all kinds of tools in the toolbox, instead of looking for that one magic bullet. The development of the one antiviral or vaccine that is going to do the job. The standard Western model of one disease, one cure, and it's the more holistic, integrative, functional approach people like yourself have been involved with for decades. So I'm all in on that. So anyway, I want to thank you for spending time with us today. I think our viewers have learned a lot. And what's really, I think, very valuable is that there's a lot of actionable points here that people can, take home messaging.
Well, thanks again for having me. It was a pleasure, and I look forward to hopefully doing this again on other topics at some point.
We will talk to you soon.
Great. Thanks so much.
Well, that was really interesting information. So now we've learned that indeed there are subtle variations in what we carry as part of our genetic legacy that not only have a bearing on our health, but also are important leverage points that we can utilize to, in fact, enhance our health once we understand what our uniqueness is. And certainly as it relates to COVID-19, we learned a lot today, didn't we, about how our genetic uniqueness might play into how we experience this infection in terms of our outcome. So I really hope you enjoyed the program. We'll talk soon. That's all for now. Bye-bye.